Hi, my name is Dr. Galit Kleiner Fisman. I'm the medical director of the Jeff and Diane Ross Movement Disorders Clinic here at Baycrest Hospital in the Assistive Technology Clinic. At this clinic, we try to focus on the person living with Parkinson's disease and encourage them to live the best possible life that they can live. We'd like to have people feel empowered that even if they have some challenges in their life, we're here to support them and to provide them with programs and with skills such that they can address living their life in the best possible way.
Dr. Kleiner Fisman, at the Parkinson's Society, we share a message on the importance of medication timing with staff working in care facilities, hospitals, and similar settings. Can you speak from a medical perspective about the importance of specific, individualized medication timing for people living with Parkinson's?
Sandy, thank you very much for this question. This is actually an extremely important point that we need to address, and we need to ensure that everybody understands. People living with Parkinson's disease have very unique symptoms. Each person is an individual, and therefore their treatment is also specifically created for them, such that when a person is told to take medications 4 times a day, that doesn't mean any random 4 times a day. There are specific reasons why a doctor decides on the times that people take their medications. The medication only lasts a certain amount of time, and different people metabolize the medication in a different way. Therefore, by changing the schedule that the doctor specifically created for that particular patient, it may result in significant disability and suffering for the patient that's completely unnecessary. If a person is told to take medications at 8, 12, 4, and 8, it's very different than when they take it breakfast, lunch, and dinner or something like that. And while I understand that, especially at long-term care facilities, there are issues related to staff time and personnel resources, it's still extremely, extremely important to highlight the fact that people need to take their medications on time. If they're even 10 minutes late, it may result in their bodies turning, quote, off, which is when the medication runs out, and they can be virtually frozen in their body during that period of time. As you can imagine, that results in extreme discomfort, anxiety, and panic for people. As such, one of the things that's very important for us here at our clinic is to extend that information that we know to other long-term care facilities such that people receive medications at the time that they need.
What could happen when someone's medication regimen is altered, either short-term or long-term, like perhaps adjusting to an altered regimented schedule when moving into a care facility?
That's another excellent question. In fact, this is the time when patients are at the greatest risk when they get admitted to the hospital for potentially another comorbid condition, or if they're admitted to long-term care because of disabilities at home. It's at this time when patients' medication schedules are often changed, perhaps in conjunction with nurses' schedules or with other regimens that exist in that facility. Oftentimes doctors are focused on other illnesses and may not necessarily pay attention to the schedules of Parkinson's medications that people come in with. The problem with that is that people may not get the amount of medication that they need and therefore have suffering and disability that's unnecessary. What may also happen is, as a result of becoming increasingly immobile due to the fact that their medication isn't managed optimally, they may get secondary problems such as an aspiration pneumonia or have increased risk of falling and therefore fall and break their hip. These are all significant problems that occur when medications are changed, and therefore I emphasize again that there is extreme importance in adhering to the home regimen as closely as possible when being admitted either to an acute care hospital or to a long-term care facility.
What does the proper timing of medication given to people with Parkinson's mean for the staff working either in long-term care or in a hospital setting?
Well, we acknowledge that personnel at hospitals are overburdened. They have many patients that they have to care for during the day. And therefore, if a patient can cooperate with the staff in administering their own care, it certainly is helpful and more efficient. It's very, very difficult to take care of a completely dependent person. When people with Parkinson's receive their medications on time, they are much more able to assist in their own care than if their medication isn't working optimally. And therefore, this results in a lot more work for the caregiver. So not only does the patient benefit from feeling better by having his medications on time, it also helps the efficiency of the hospital in terms of the workload on the caregivers.
Is there anything else that you feel is relevant to the care of clients with Parkinson's in general, and specifically with respect to the theme of get it on time?
This is a very important question. And unfortunately, Parkinson's disease is a chronic degenerative condition. Therefore, we can't change the fact that it's only going to get worse, and that people living with Parkinson's suffer extremely and have a lot of disability. However, we do have a toolbox that we can use, and that toolbox, if we can use it to its maximum effect, then we can really do everything in our power to allow people with Parkinson's to live the best possible life that they can live. And I feel that as healthcare professionals, we owe it to them to do that. As such, one of the few things that we can do to help people is to provide their medications as they're prescribed, such that they can get their optimal effect from it, and they can live the best possible life that's possible for them. Thank you.